That was the Sunday we gave out blood pressure monitors, blood pressure monitors. So he has graciously consented to come back today and to talk about artificial intelligence and healthcare. Now, I don't know, if you've been affected by artificial intelligence? Every time I Google something now, AI comes up. Okay? And so AI is having a tremendous effect and a tremendous impact in all of our lives and in every step of our lives. So I was talking to Dr. Dambita a little bit earlier this morning, and I asked him, how did AI get started? What was the generator? And he asked me one question. He says, "Do you remember the was it the Jetsons? Do you remember the Jetsons and the imagination that went with the Jetsons?" Well, that's where artificial intelligence got started, and it is just boomeranged. So, Dr. Nambita is a clinical director of the African American Health Program, and as you know, we partner extensively with the African American Health Program, supporting us in many of our health-related activities. So he really needs no introduction, but I'm going to turn it over now to Dr. Dambita, and let's give him a warm Colesville welcome. Dr. Dambita.
Thank you, Dr. Smith. And good morning to all of you on this Pentecost Sunday. I hope the Holy Spirit is going to guide me through this presentation and not artificial intelligence. I'm glad that you all invited me back. That means that the initial discussion and the artificial intelligence devices that were given to some of you, the blood pressure cuff, that's artificial intelligence, actually. And I'm here to talk about, to share with you what I know about artificial intelligence. So let's get started. The agenda is simple. Today, the agenda is we're going to define what it is. And I'm going to just show pictures of many devices that we use in the healthcare and some of the conditions that are being that lend themselves to artificial intelligence. And it's not all good. There are a lot of benefits. We explore those benefits, but there are some drawbacks as well. And have a little discussion because we are people of faith. We are believers. What do we need? How should we approach this artificial intelligence? So, I'm coming back. So, anyone can tell me what artificial intelligence is? There is a microphone in the room. What do you think artificial intelligence is? Yeah.
My guess is it takes, pulls information from the cloud, pulls it up into a cloud and massages it to see what it's in what it has in common, you know, based on whatever the question or information is, and then form sentences and paragraphs.
So it is a data cruncher. That's part of it. Does anyone have another definition of artificial intelligence that would like to share with us? You heard of Siri, Alexa, Amazon, Google? Yes, all those are examples of artificial intelligence because those can look at phenomenal data, crunch it, and make recommendations. They can assist us. What's the run one that cleans your house? Broom. Yes. Some of you may have that at home. That's artificial intelligence. So it's not science fiction. It's not a Jetson anymore. It is all around us. It is helping us. It's predicting the weather. It's predicting how well you will do. Thank you. Uh, it can make recommendations. And what it is that anything that we do, those machines, artificial intelligence is uh, machines can help us do what we're already doing. So we're just giving them a little bit of a brain power. That's what it is. And those machines, the great thing is about them, they can learn. Okay, the IBM Selectric we used to use back then, they just type. They help you type, but they don't learn. They don't tell you when you're making a mistake. Uh, Nowadays, you go you use Word, and if you're making a grammatical error, it tells you, and you change it. That's all it is, artificial intelligence. Um, Now, we have those virtual assistants that we mentioned. We mentioned uh, Google, we mentioned uh, Siri, Alexa, and all that. Uh, and also, in addition to that, we have social media because some of you are on Facebook. And isn't that amazing? You go on it, and quickly it was able to identify all your former classmates or friends and family, and it's suggesting for you to connect with them. Yeah, people you may know, and sometimes people who may you may not know. Yeah, may know you. Yes, and the you get into your car. Before, we used to read those maps, right? You go to AAA and you line up, they give you a car, a map, and then you map your trip. We have GPS now. GPS takes you to where you want to go from point A to point B. So we interact with artificial intelligence more than we realize. From asking directions, watching videos. If you go on Prime Video or any of the Netflix, they make recommendation based on what you watch. They said, okay, the next thing we recommend to you, similar to what you already been doing. That's what it is. So it is everywhere. Customer service, and that's one of the drawback. You have to know how to, at our age, we slow down. We don't text, we don't type as efficiently. But that's a problem for us because you want to ask a question about a new uh, equipment that you just purchased. You go there, or you want to question erroneous bill. It asks you. You have a chat box. It's not a person. It's a machine that you're actually communicating with, and they're telling you what is your problem, and they're trying to look in their database to solve it, to guide you through it. But we're here because we want to see the tools, the artificial intelligence tools that we use in healthcare. It helping doctors. I don't think it's time yet for them to replace doctors. Yeah. Still, Dr. Smith, with all his skills as a dentist, no artificial intelligence equipment at this point can replace him. But it can give him some tools to better assess. My daughter was telling me yesterday when I was preparing this lecture, because we went to our new school, and she's describing a scanner that can take was that 600 or 6,000 pictures of your mouth? It's 600, and and make up the model. So that is helping, but it's not replacing. So let me ask you, having given that preface, what do you think the proportion of healthcare organizations that are using artificial intelligence? Is it 20%, 50%? Huh? How much? 100. Nearly 100. You're very close to it. Yeah, it's about 85, 80 to 85%. They're using it, and there are different types. Uh, you, we have these. We gave you the wristband for blood pressure the last time. That's artificial intelligence, because before, to know your blood pressure, you have to have a doctor, you have to have a nurse, and they have to have a stethoscope. They have to have this big machine. I still have one with mercury, and it's called sphygmomanometer, because you use actually your hand to do it. But this wrist thing can tell you what your blood pressure is. And further then, now there are some watches that can tell you what your blood pressure is. They can give you all this, those 85% of the healthcare using artificial intelligence. More devices. This is an Aura ring. And actually, it's a ring, but that can tell you so much. You have, of course, you have to send the data onto your phone. It would tell you your heartbeat. It tells you your temperature. It tells you your so many things. I don't have one. I don't own one. But my colleague at work has this one. He's so proud. Mr. Mafan is so proud to use his Aura ring. And the prices are coming down. And I'm told that you can get one on Amazon for about $35 or so. Okay. So more, yeah. Those, you actually wear them. Huh? You wear them and they tell you your blood oxygen level. They tell you they can do actually EKG. Okay? And you have one, those who have cardiovascular disease, I may have mentioned it during our last presentation, what is called Zio patch, that they affix it to your chest, and you keep it for 2 weeks, and will continuously measure your heart rhythm. It's like an EKG that takes all this information, and that's a lot of data. What artificial intelligence does is that it turns around and draw the conclusion. It tells you, for 2 weeks we've been observing every single minute, every single second of that individual, and this is what we've come up with. So your breathing rate, respiration, all that, activity level on your watch, smartwatch, or your phone. If you're just carrying your smartphone around, it will tell you how many steps you've taken today. Okay? And suggesting to you, said, you have not done enough exercise for the day. Okay? That's, yes. So, and one area that is really fascinating, because we have this diabetes prevention program at the African American Health Program. And the persons with diabetes, and I say person with diabetes, I don't want to use a person, I don't want to say a person is diabetic or a person is pre-diabetic. That interferes with the control and the management that we are, the concept of management we're trying to convey. Because it's just like you say a person is, you don't say a person is cancerous. You say a person has cancer. So we need to think the same way for diabetes. The person has diabetes. That means it's a condition that you can manage you can change, you can even reverse diabetes. So having something like an intelligent insulin pump uh, that if you pair it with the continuous glucose monitor, it can automatically, very intelligently decide that this person needs a little more insulin. This person, this is too high. I'm going to send a warning so that their risk for glycemia is too high. They need to do something because that's an emergency. Hypoglycemia actually uh, kills more rapidly than hyperglycemia. So having that. Devices, EKG, I already mentioned that. Heart monitors, and I mentioned the Zio patch. Uh, and people with asthma, they have some smart inhalers now. And medical alert system so that we have this program called remote patient monitoring. And we are limited in a number of equipment that we use one for blood pressure, for oximeter to measure the oxygen. We use weight, weight scales, because our uh, doing the prevention for diabetes, you need to monitor the weight. So what it is, you keep this equipment, and we ask you during the month to use it for 16 days. And in the 16 days, if there is, as you using it, we're getting the data automatically. And it's nothing new. They use that in ER. When you go into ER, they have all these machine hooked up to you. That's what it is. It gives signals if something goes wrong. Artificial intelligence again. Uh, to monitor babies in utero, uh, fetus, heartbeat, kicks, and all that. There is some devices that can do that for you, for the baby. So many conditions that is helping us managing hypertension, uh, congestive heart failure, diabetes type 1 and type 2. I spoke to that as well. The asthma, we talk about that. And then not just the chronic conditions, acute conditions like a woman pregnant who's approaching delivery and goes into this wild, high hypertensive crisis called preeclampsia. And that actually threatens the life of mother and baby. Okay? If you're being monitored, you know that ahead of time, and then get you quickly to the hospital. And the treatment is very simple to control the preeclampsia. Gestational diabetes, that's quite frequent in women, and that's also, it's not a permanent condition, but if it happens, it's a good idea to know that the woman is having gestational diabetes, because guess what? Years later, that woman is at risk of developing diabetes. She will have, that's the definition of having pre-diabetes. And organ transplant recipients, they need to be monitored. We need to monitor weight, sleep disorder. Now, this is the thing. With your smartwatch, as you sleep, it detects your sleeping patterns. And it can tell you whether you're getting enough rest, whether you having sleep dyspnea or apnea. And all these conditions, it's easy to monitor these days thanks to artificial intelligence. And the last thing I should mention, it's very important for our seniors taking multiple medication. There are some applications that you list all your medications, and it will tell you which one is interfere with which one, uh, how, when to take your medication, and all that. So it's in a way that's good. Keeps you adhering to your medication. Now, using AI to solve complex problem, it helps us do that with incredible efficiency. There's no doubt about it. You could have a clinic now, maybe on the Eastern Shore in one of the rural areas. If there's a clinic there, they don't have to come all the way to Johns Hopkins, because through the connectivity, they can talk to some of those specialists, those experts at Hopkins can now diagnose what is happening in that little clinic in rural area. You don't have to take them by helicopter to bring them to a clinic in a central location. So all this is good. It's connecting the rural with specialists remotely. ER room, okay? One of the things that's happened in ER room before being into ER is it's a long wait, isn't it? Okay? But artificial intelligence, that's also in the area of operations, can determine the flow, the workflow, and the workforce needed to make it more efficient and to reduce the wait time and to get the the treating team, to get to the persons that need to be, that are high priority in terms of management. So, and you want to schedule an appointment with your doctor, man, now it's more than likely you'll be talking with a computer. The computer will ask you, will give you all the schedule, and tell you what time to come. It can, and of course, many of us consult with Dr. Google. The problem with don't take it at face value what you Dr. Google tells you. Dr. Google cannot replace, I cannot emphasize that enough, cannot replace you, your good old doctor. So all this to say, it does improve access to care. It does make the industry more efficient, and also in the area of, you see how quickly they develop a vaccine for COVID. Okay, that's artificial intelligence is helping to do that, and so is an acceleration of an enhancement of drug development. So, what are the areas that that in the healthcare that AI is bringing this revolution, is changing the game, as it were. It's many ways, and what you said at the beginning, I keep coming back to that. It will scan a phenomenal amount of data, and that even expert doctors may not humanly possible for a human doctor to survey, to scan all this, to gather all this data to do it. And with computers being ever more powerful, with no more problem with storing data. You mentioned the cloud. That's what it is. The cloud is just hundreds, thousands of computers getting together and providing the space that is called the cloud, because no one sees it, no one knows how it works. It's not actually in the cloud. It's on a farm somewhere. Yeah. And that, so we through that, we get to catch disease much earlier. And that's the whole difference. That's the whole difference when you catch it early. The now used to be you go to your radiologist, the you have to wait for them to read the images, the X-rays, the MRI, and it would take them time to look through all this. But with artificial intelligence, what happens is that uh, the minute you had that procedure done, the computer has already uh, gathered all the information, not only that the current information, but it will look through the past. If all your medical record is in one place, it will look through all of this and suggest areas, suggest diagnosis to your radiologist. And he just have to look through it. Oh yeah, I think this is correct. This is correct, and validate it, sign off on it. That's the way to do it. That's why you get your X-ray reading done so quickly. It's artificial intelligence is helping you, and it help us. It does help also personalize medicine. Uh, all Not all persons are uh, equal. Our needs for medication varies. How pathology, how pathogens attack us is different. So you have to have, you have to be at the level where the treatment is personalized. It's this whole new area called precision medicine. That's what it's all about. It will look at your DNA, it will look at your whole history, your family history, and look at your physiology, and say that for you, if you have cancer, this is what would be appropriate for you, as opposed to a dose that will be given to the person next to you. Okay, and that's what is called predictive analytics. Uh, they're trying to do that, and then the administrative operations also are part of what automated medical records is all about. Now, so to summarize how the model it is, it takes a lot of, it takes your genetics, takes X-ray images, your blood sample, and get all these results together, because you can't have to wait for the pathologist to tell you what's wrong with your in your blood. You don't have to wait for the radiologist to read the X-rays. You don't if it's an hereditary disease, a genetic problems. It takes a long time for geneticists to tell you what's wrong, which gene is not functioning well. It takes time for that, but the artificial intelligence takes all this. You feed that information into the artificial intelligence model as a model. The model look at all for a given pathology, looks at everything around the world, all different people, and then can suggest diagnosis, can suggest the treatment that is appropriate for you, and tell you how well the prognosis of your condition. So clearly there are some benefits. So let's talk about the benefits of AI. Can really be a force for good, okay? And it will help us live better, live healthier, and safer lives, okay? This is it. There's no doubt about it. It's convenient. You can just give a, oh, this is a new thing. Have you recently been to your doctor and he has some kind of recorder? You have. You know what that recorder does? It, mine, yes. Yes. Yeah. Exactly. Yeah. What it does, the artificial intelligence is listening to you as your doctor is asking you questions. It's taking all that information all along, working in the background. And by the time you finish, this, the discussion and the conclusion of your visit, it's already in your medical record. That's why before even you leave the clinic, it will print that summary for you. So that's what it is. And we more and more, we're gonna interact. We're gonna talk to. We're gonna and it's great for the physicians because you don't have to walk around. Remember when the doctors will just type on the iPad, and you want to have eye contact. You want to interact with them. It was not possible. So now with a recorder taking this and doing all that work, it can have time to talk to you. Even if it's 15 minutes, it's a good interaction. So I have to mention that.
The thing I have to say,
Yes.
I know I shouldn't interrupt because it's fascinating. But the thing I have to say is that thing is in our homes listening too.
Yes. Alexa is listening to you.
If it's listening, it can take that
You
information,
can,
send it to
yeah.
Trump or something.
No, I don't know if he's sending it to Trump, but it is supposed, and that's the thing that we have to when we start looking at the drawback.
You go into that loss of anonymity.
Yeah, 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 yes. That's good. We're going to go into that. Those are the drawbacks. That's something that we have to pay mind to. So it help us with safety, help us with access to tools for disabilities, improve our diagnostic capacity, and it can process all this data rather quickly. So, well, for one thing, it's displacing a lot of people, particularly support people around the hospital. So people are losing some jobs. Uh, and this is a thing, as Black people, we have to pay attention to. I show you that model, what is called the uh, artificial intelligence model, where you're feeding this data in and the machine is learning from it. We are not represented. So it's built by people who have own personal bias. And the vast majority of data that is being fed into those machines are from the average white male. Okay? Average white male. And the population, the white population, both now males and females, it's their data that is going there. We're not represented in that. So it cannot make accurate predictions about us. So that's a big drawback of those systems. Uh, they don't have, so whatever, believe it or not, whatever racism, whatever bias we're combating right now in society, those are now being programmed in those algorithms. That's what artificial intelligence is. Someone is writing those codes. It's not us. Okay, and that's a danger for us. Privacy issue, you mentioned that. Uh, if do not put your personal social security, your name, your condition, the medications you're taking. Please do not use those in those tools. So we need to be extremely cautious. Not everything that AI does is perfect or fair. So we have to ask tough questions because remember, those systems are not HIPAA compliant. So they don't care about your personal information. They can disclose it. Yes, go ahead.
Well, that sounds like a dichotomy, because you're saying that most of the data that AI collects is from people that are not of color.
Yeah.
How do people of color get their data into
Well, this is I think it's a big question, very good question, excellent question. This is something that society, just like uh, as long as society remains as long as racism continues, implicit bias lives in us in society, what those systems are doing is reproducing what society is already uh, experiencing. So the same battle, same way we approach implicit bias, the same way we approach, we have to retool those uh, those strategies and use it in the area of artificial intelligence so that we are represented. Okay? I don't know if that answers your question. Uh, yes.
The problem is that Silicon Valley is dominantly young white males. And if we get more black people involved in IT, computer science, and all those projects, then we'll get into the system. So
Oh.
we have to push more of our young people into STEM programs, and that will allow the systems to get a balance of income.
That's an excellent point. Uh-huh. Mhm.
I hear you. But I tell you what, most of a great number of people that are in information technology, they're probably in Silicon Valley, that's where the money is as well, come from India.
Well, mhm.
Any place that I had worked, including the federal government, you have to be a U.S. citizen.
Uh-huh.
When I first started with them, my orientation class was at least a third to half of the people were from India. And I'm not saying that's wrong, but they focus, they like IT. So in other words, what I'm saying is, it's not all. Yeah,
Yeah.
and I see the younger people getting, people my age, not so much, well, I'm retired.
Uh-huh.
But they're starting, the young people, my friends' kids and grandkids are getting in too.
Yes, I hear you. And you.
I'm sorry. But it astonishes me that a system this advanced could not distinguish cultural differences.
Yeah.
Seems like that would be elementary type consideration.
And this is the thing. It's not supposed to be fair. It's supposed to be whoever is running it, is it advantage, does it provide advantage to me? Okay? And that's why the point he's making is that getting people of colors. Yes, you mentioned the Indians. They're people of colors for true, but they work for bigger entities that tell them what to do. We tell you, I want you to program this. Witness what is happening with Doge. Doge are young people that have no experience in how society works, how government works, and you just tell them, cut jobs. And they just took they cut jobs, they cut lives. Yeah, Dr. Smith has been. Yeah. And that failure to participate goes back to Tuskegee experimentation. And so we have a distrust of the system. And the point I want to make is that with artificial intelligence, that distrust should be even more intense because of all this. We're not represented in clinical trials. We're not, our data is not sought after to enter those model. Yes, you have a. Yeah, thank you for making that excellent point. And that's part of the discussions I had in mind. The regulatory and the system of checks and balance is lagging so far behind the technology that there, you need congressmen that understand the danger of this to put some kind of guard rails around it. But that currently does not exist. Look at what Congress is discussing. They're the one making the laws. The laws would not, I'll say maybe 50 years behind the technology. And that's problematic for us.
How do you speak to the fact that recently, I guess yesterday, recently, the Supreme Court opened up the social security numbers to Trump and Musk?
Well, Musk is a businessman. He's been trying to get hold of all the data about all of us. We provided, and this is someone who was not elected, but he was given access to that. So it's wrong. It's unfair. It's unethical. But that's the way those people they just want what is good for them. Garbage out. Yeah, Geico. Yes. Exactly. Oh, okay. Yeah. Good point. Good point. So let's, very quickly, we talk about what are the information you need to protect. You need to have your detailed, don't share your detailed medical history on any of those platforms. Don't put your medication list, even though an app is telling you, got to make sure that this app is not linked to your personal record, personal telephone. You can use, yeah.
When you say that, you mean don't put it into ChatGPT or
No,
other places. You
yeah.
have to have your doctors.
Doctors, yeah, exactly. Yeah, yeah, just to clarify, yes.
Probably sounds like a real simple question,
Uh-huh.
but how can that be abused? Like, say if I have my blood pressure medication, something floating around and it can go into a database.
Uh-huh.
In your opinion, how can that be abused?
Well, it can be used by an insurance company to deny you insurance. Or in certain jobs, it can say that you're not fit for the job. Yeah. Yeah, raise your premium. There we go. So that's, and again, they are not HIPAA compliant. HIPAA has not, the law has not been, does not apply to artificial intelligence. To those devices, you can just develop good engineers, you develop a device, And that's it. You do as you plead. FDA approves it, and that's it. Yeah.
It seems as if we're coming to this, like the horse is already out of the barn, and we're looking to see if we can close the barn doorway.
Exactly.
Because most of us have already given, not necessarily on ChatGPT or whatever it is, but I can think about all the times when people have asked me for my medical history and what your father had and what your brother has and all that stuff, and I probably shouldn't have done that. You know,
The doctor's office, that's my hip, but that's fine.
yeah, but then
Yep.
the doctor gets bought out by somebody else, and then, you know,
The hip is still current.
Yeah. HIPAA protects that. The thing of it is that those companies, the one that does genetic, that has gone bankrupt, it's collected so many. Huh? Yeah, 23. Yeah. Uh, all that information, now that they've gone bankrupt, what is going to happen to that data? If it's bought by someone else, yeah, it's bought by another company. Yeah, exactly. Okay, we already talked about those. Where do I see uh, the future of AI? Still in those areas of early detection of disease, the area of surgical advancement. Most of surgeries now, major surgeries, are done by robots. Okay, uh, and that is helping. Development of vaccine, COVID is an example, and then virtual care. We already mentioned that. That is maybe because there is money to be made in it. It may take precedence over, an actual physical visit to your doctor's office. That's where I see where artificial intelligence is going. But uh, as believers, we are called to use everything, including technology, for good, in love, and for service, don't we? Okay? So, our values as Christians, are they reflected in the building of those devices or even the use of them? Is it promoting the love, the service? Is it preserving our dignity, the dignity of others? Are we using it wisely? It's a tool, but like any tool, it can use for good, it can use for harm. So, what we have to those references, we actually don't need the Bible to tell us that, but the wisdom in Bible can tell us how to approach anything new, like this new technology. And I think in James, we talk about wisdom and discernment. That's what it is. We have to have the wisdom and to discern what is good for what is could be based on our Christian values in the use of those equipment. And does it help? Do they help us love and care for one another? That's a question we have to ask. And in terms of stewardship, also, is it helping us doing that? And is at the end of the day, what we do when we use it, do we honor God, or are we using it to compete with God? So that's very important. As I don't have any answer, but if we reflect on this, if we think about it, and keep that in mind in the back of our head, I think we'll be better prepared to deal with all these things that is happening in our society right now. So my advice is that we should not just be helpless bystanders. We can influence how AI is used. And we want it to be used ethically, we want it to be used wisely, we want it to use faithfully. So We have to stay informed, learn more about AI. What you did today, asking me to come talk about AI, this is a beginning. But do your own homework, ask questions, uh, consider this AI, this device, this new thing. Is it really having an effect on other people? Is it helping or is it hurting? Uh, and if we feel those speaking up against those ethical breaches, that's very important. Uh, and let's just pray for wisdom. And we technology really needs to be guided, uh, and we have to have those uh, guardrails. So let's walk away today, not with fear of all that, but with understanding and hope. Together, we can shape a better future for AI and a better future for ourselves. So those are my final words for you today. As faith community, we can help shape ethical use of those tools. So uh,
Thank you, Dr. Dambita, and for that wonderful presentation. I think you answered a lot of our questions. You may have even stirred up some thoughts that we might have, or may even have been thinking about. But it all takes us back to who read George Orwell's 1984.
for
All right, it's here. Okay. Any questions?
Yes, I'd like to know, since there are no regulations and, uh, which are much needed, how is the healthcare industry and the medical personnel being trained in the applying AI and taking care of the patients?
yeah.
I'm concerned about the personalized part of it. And when does the doctor decide to use more the human touch and the human input versus the AI input?
Uh-huh.
There has to be some kind of a balance there in personalized.
Yeah, you have a couple of questions in there. What I can tell you is that in terms of do they teach the ethical use of AI in schools as they train the workforce? Do they? Is there any thought, any consideration to teach them that? And no, what they learn is how to use those tools. And your second question is how much should your doctor rely on artificial intelligence to take care of you? Yeah, it's inevitable. They will have to use those tools, different tools, to better help you. So again, the relationship you have with your physician, and always you have that you have that right to go seek another second opinion or another doctor that you think is not taking care of you the way you need to be taken care of. That's all I can answer to that.
Okay, thank you.
Thanks. To piggyback on that, of the 20%, I think you said it was 20% of the US healthcare industry that's not using AI. Is it about 20?
Yeah, it's about
Yeah.
20.
So is that purposeful? Is it in a particular
No.
segment, or is it they just lack the technology?
They just lack the technologies.
Oh.
That's what it is.
Okay.
Okay, there are the questions. If not, Dr. Dambita, thank you again for coming back and sharing this information with us. It has been very exciting to hear this. I appreciate it so very much.